On this Tuesday night, fast-tracking solutions for medical supplies. Thousands of Canadian companies race to refocus.
What's unprecedented is the speed.
And thousands of defective face masks are recalled. The British Prime Minister spends another night in the ICU.
He's a fighter, and he'll be back.
His prognosis as Britain's death toll soars. New York's deadliest day of the pandemic.
I don't know if any of us will ever be the same after this.
Could that city have reached a turning point? Giving a possible gift of life. Human clinical trials underway using blood plasma from COVID-19 survivors. And the pressure on Canada's caregivers.
It just adds to the isolation.
Unsung heroes in uncertain times.
What happens if we both get it?
Global National with Dawna Friesen.
Good evening and thanks for joining us. We want to start with some promising news tonight. The federal government says it has made lots of progress on getting much needed personal protection equipment for frontline workers. And the strategy is very much made in Canada. Nearly 5,000 companies, we're told, across the country have offered to retool to make medical supplies. An auto parts company, for example, is using airbag material to make hospital gowns. Other companies have struck a deal to make up to 30,000 ventilators. It's all part of Ottawa's plan to buy, and build until the medical system has what it needs.
We have told these companies across the country who've put up their hands to go ahead and get building ventilators as quickly as possible and as many as possible in case we need them in Canada. We certainly hope that we won't be needing all those ventilators.
The government is buying supplies from overseas too. Gloves, gowns and masks in a market that's described as like the Wild West. Countries are all competing for the same dwindling pool of products. So far, the federal government says it's sourced more than 230 million surgical masks. Over 16 million, it says, have already been delivered. In our top story tonight, Mike LeCouture looks at the Canadian companies that have taken up the call to help.
It was a lifesaver in the 2003 SARS outbreak, and an updated version of the Winnipeg ventilator could help thousands of Canadians survive COVID-19. The Canadian-made ventilator is being retooled by a cluster of companies, including Starfish Medical, that hope to accomplish the Herculean effort of making thousands of these in a short time frame.
Normally something like this would take 2 or 3 years, and we're compressing it into weeks to months. We were hoping that we'll get through all of our clinical testing that we need to do and regulatory during May, and then we'll be manufacturing as soon as we can.
At the same time, the Prime Minister has tapped Nobel Prize winner Dr. Art McDonald to fast-track his easy-to-make ventilator, which will be tested in Italy.
We hope to get full medical certification there. We've been working closely with the FDA in the U.S. and Health Canada. We expect to be able to produce these objects starting in a few weeks' time.
The federal government has ordered 30,000 ventilators, even though Canada may not need that many. But if we don't, Prime Minister Justin Trudeau says they won't go to waste.
We will have ventilators to share with other countries that are facing more difficult circumstances. For us, doing more right now, doing quicker right now, is really the only option.
Manufacturers like Canada Goose and Stanfield's are now retooling their operations to make medical gowns for frontline healthcare workers. The government is also in talks with nearly 5,000 Canadian companies to make personal protective equipment, so we don't have to rely on buying it from other countries because supplies are so scarce.
Ordering, of course, does not guarantee a delivery.
The lack of PPEs has frontline workers worried will run out, and the nurses' union is appealing to citizens who are now wearing masks.
You see somebody from the public wearing a surgical or an N95. They don't belong on the street, they belong in our healthcare system.
Now, there's a huge rush to get all of this equipment, but faster isn't always better. The City of Toronto had to recall about $200,000 worth of surgical masks, citing poor quality. And those masks were sent to long-term care homes where the need is even more acute. Dawna?
All right, Mike LeCouture in Ottawa, thanks. The Premier of Alberta says his province is facing a triple threat: COVID-19 and the collapse of the economy and of energy prices. Jason Kenney released 2 disease models tonight. He said the probable scenario is that infections will peak in mid-May and that there would be between 400 and 3,100 deaths in Alberta. And this, he says, is the elevated scenario.
Under the most serious but less likely elevated scenario, we would see infections peak at the beginning of May with as many as 1 million infections and between 500 and 6,600 deaths. But these models are not a done deal. I want Albertans instead to see them as a challenge, perhaps the greatest challenge of our generation.
Premier Kenney says restrictions like physical distancing will not be relaxed until the end of May, and he plans to ramp up an aggressive system of mass testing and do as many as 20,000 tests a day. Here are the number of cases in Canada right now. More than 17,000 people have tested positive for COVID-19. More than 1,200 new cases were reported today. Ontario and Quebec had the biggest daily increase in new cases. Ontario confirmed 379 more cases. Quebec reported 760 more people tested positive. But in BC, there were only 25 new lab-confirmed cases. That's the lowest daily increase that province has reported in weeks. And some breaking news from Ottawa tonight. The Deputy Minister of Global Affairs, Martha Morgan, has tested positive for COVID-19. The government says her symptoms are mild, and she is now self-isolating. The numbers across Canada don't affect the whole story, of course, because testing is still limited in Canada. And it's still too early to be certain of anything. But there are signs the overall curve in Canada is showing signs of flattening, especially in BC. One of the biggest concerns everywhere are outbreaks in long-term care facilities. There are at least 51 outbreaks in homes in Ontario alone. Eric Sorensen is analyzing the data again for us tonight.
Unquestionably, Quebec has been the hardest hit province. Now, a long-term care facility in Laval may have one of the worst COVID-19 outbreaks in the country. 105 residents have tested positive. 8 have died. As of today, in Quebec, 150 have died from the coronavirus. The province is projecting the number could be over 1,200 by the end of April. In a worst-case scenario, more than 8,800. But officials do say Quebec is on course to handle the outbreak so far. The Premier says this is a critical week to contain the spread.
There must be no gatherings, including for religious celebrations such as Easter.
Sound advice for the nation. As hard hit as Quebec is, the Premier says the province is heading in the right direction.
We're making progress in our battle against the virus.
And so is the country making progress. The number of COVID-19 cases in Canada continues to rise, but there has been an improvement in the daily numbers. After a sharp rise to over 1,200 cases on one day last week, the numbers began to flatten out a little bit. In fact, there were fewer than 1,200 yesterday. British Columbia stands out, no longer a sharp rise in the total numbers. And look at the daily cases. For 1 week last week, BC had an average of 71 new cases per day. But this past week, just 42 new cases per day, a distinct downward trend. All of Canada is ahead of early infection forecasts.
Typically, this virus is doubling every few days, and we've definitely seen a slowdown in that. We're still seeing increases in cases, but they're not increasing nearly as fast.
What happened? A dramatic change in behavior everywhere. Google geolocated the movement of Canadians last month. Public transit hubs, usage down 2/3. A plunge in retail, shopping, restaurants, movies, many just closed up. A big drop in going to our usual workplaces, instead working from home. Even grocery and pharmacy, Canadians are going, but less often. A steady falling off in visiting parks as we keep our distance. And the one upturn, of course, residential, as we spend more time at home.
Because we saw people come together March 31st and stay at home, we should start to see the effects of that now in the second half of April.
Grim mortality numbers still lie ahead for this country, but by all indications, the main approach, staying away from other people, appears to have been the right strategy, if we can keep it up. Eric Sorensen, Global News, Toronto.
It is situation critical in the UK tonight. Prime Minister Boris Johnson is spending a second night in intensive care battling COVID-19, and the UK recorded its highest daily death toll so far. 786 people died in 24 hours. Crystal Goomansingh has an update on Johnson's condition.
In the middle of a crushing financial and health crisis, Britons are deprived of their bombastic leader.
It is quite worrying for the country, for people in general, because what's going to happen? He's the leader, right, of the country.
My thoughts are with him and his family, because obviously it's a very worrying time for them.
Boris Johnson remains in the ICU. He's said to be stable, breathing on his own, but has required oxygen. The designate, Dominic Raab, tried to calm fears, saying he has no doubt Johnson will be back soon, but he didn't shy away from the emotion of all of it.
It comes as a shock to all of us. He's not just the Prime Minister. For all of us in Cabinet, he's not just our boss. He's also a colleague, and he's also our friend.
The Cabinet works closely, literally. This photo from inside Downing Street was taken in February. Social distancing had been applied, but in the early days, so much time was spent working shoulder to shoulder. A number of government officials have been infected or showed symptoms. UK hospital admissions are rising, as are deaths. Tuesday saw the highest daily death toll. So far, COVID-19 has claimed more than 6,000 lives. With so much uncertainty, solace from the Queen. She reached out to Johnson's pregnant fiancé and his family, sharing her well wishes for everyone to see. Crystal Goomansingh, Global News, London.
There was some hope Spain had reached a plateau. The number of deaths had been dropping for 4 days, but today it rose again. There were 743 deaths in Spain in 24 hours. That is 100 more than Monday, and more than 5,000 confirmed new cases were recorded, a rise of more than 1,000. Spain has the second highest number of confirmed cases of COVID-19. The U.S. has the most. In France, more than 10,000 people are now known to have died from the virus, and officials there warn the country has not reached the peak of the pandemic. More than 1,400 new deaths were recorded in France overnight. That's the biggest single-day increase in the world, though the number of new cases did drop. Lockdown measures were tightened today. All outdoor sports activities between 10 a.m. and 7 p.m. in France have been banned, and police are switching to foot patrols and using unmarked vehicles to enforce the rules. Officials in New York State believe they are close to possibly reaching the apex of the outbreak, though today was the single deadliest day of the pandemic there. At least 731 people died in New York State in 24 hours, but fewer people are being sent to intensive care and being put on ventilators. As Jackson Proskow explains, thousands more are still expected to die.
New York's darkest day yet brought wave after wave of deaths. And no relief for overburdened hospitals. Funeral homes can't keep up with the endless cycle of grief.
We're overwhelmed. My staff they're on wit's end.
Every victim has a story, and across the U.S., those stories involve people of all ages, from all walks of life, all taken by the virus.
I don't know if any of us will ever be the same after this. There's going to be a lot of trauma from this for the medics and EMTs.
In the surge, officials see small signs of hope. In New York, the number of people hospitalized increased only slightly in the last day. Fewer people are being sent to the ICU.
Have you seen anything in recent days that makes you optimistic?
I don't see a lot of cause for optimism.
Dr. Peter Hotez warns that even if the curve is starting to flatten, there's still a long, grim road ahead.
I likened it to the eye of a hurricane, where just because you're seeing the eye, you have to remember the other half is still to come. So there's still going to be a lot of serious illness and death, even if they have plateaued.
The peak has come on faster, the rate of deaths higher than expected. The scientists, whose models forecast more than 100,000 fatalities in the U.S., say social distancing has helped, but it has to keep going.
We are seeing that people are sticking at home, they're adhering to these messages, and there is less mortality, and it's going to go down faster as long as we maintain these measures of social distancing.
And that is the question here. How quickly do those case numbers start to drop off once they reach their eventual peak? The experience in other countries is that it has been a very long, slow, and painful descent from the top. Dawna?
All right, Jackson Proskow in Washington, thanks. Tokyo now under a state of emergency. Coming up, what more than 9 million Japanese are being asked to do tonight. Japan declared a state of emergency today for Tokyo and its surrounding regions after a surge in confirmed cases of COVID-19. It's not a lockdown, it's a request for people to stay home, and there are no penalties for violating it. The measures are being criticized as coming too late. Japan has almost 4,000 confirmed cases of COVID-19 and close to 100 people have died. China reached a milestone today. According to official figures, no new deaths from COVID-19 were reported. That hasn't happened since January. And after 76 days of lockdown, the city of Wuhan, where this pandemic started, has been liberated. Residents were allowed to leave the city and go to work. There have been 2 new cases of COVID-19 in the last 14 days. China had more than 81,000 confirmed cases and over 3,300 deaths. Russia is reporting its largest one-day spike in cases. More than 1,100 people have been tested positive in the past 24 hours. Officials say 58 people have died from COVID-19 in Russia, and there are almost 7,500 people believed to be infected. Many regions in the country are under lockdown. Moscow is hardest hit. Clinical trials ahead how COVID-19 survivors may be able to save lives.
You're watching Global National.
India's government is lifting export restrictions on an anti-malarial drug that the American president has said could be a cure for COVID-19, even though there's no scientific evidence to back that up. India is the largest producer of hydroxychloroquine. The Indian government had banned exports of the drug to protect domestic stocks, but Prime Minister Narendra Modi eased those restrictions under direct threat of retaliation from President Trump. The drug is being tested, but it has not been proven as an effective treatment for COVID-19. Canadian patients are now part of a human clinical trial of an experimental potential treatment for COVID-19. It involves giving antibody-rich blood plasma from people who have recovered to patients who are still infected. Heather Yourex-West explains the theory and the trial.
As Canada's hospitals brace for the coming wave of new coronavirus patients, those who have already survived COVID-19 will soon be called upon to help.
We're reaching out to public health to actually get lists of patients who they have defined as recovered from COVID-19, and we will be inviting those people to participate as plasma donors.
People like Karen Shoemaker. The 74-year-old spent several days in hospital last month, but she's now out of isolation and doing much better. Researchers believe her blood is now filled with antibodies that know exactly how to attack and stop the virus that causes COVID-19.
You can't say you were fortunate to have it, but we're fortunate that we healed. And if we've got some antibodies that can somehow be checked to see if they can prevent other people from getting it or even help people who currently have it, why wouldn't you share?
Using donated blood as a therapy is not a new idea. Convalescent plasma has been used for more than 100 years, with varying amounts of success.
The data that we've got to go on is really, really soft right now. It's very hard to say if this actually works. There's good biological rationale to think that it might, but we just don't know.
It's why a team of researchers from the universities of Montreal, Toronto, and McMaster are racing to set up a major Canadian clinical trial, partnering with Canadian Blood Services and Quebec to collect donations from 1,000 COVID-19 survivors.
There are so many moving parts. We need to ensure that we have a supply of this product from eligible donors. At the same time, we want this to happen quickly because the peak of demand for patients who are going to be in hospital with acute COVID infection is going to happen in the next few weeks.
Shoemaker says she's willing to help at any time, hopeful that whatever is now in her blood could be enough to save lives. Heather Yourex-West, Global News, Calgary.
Canada's caregivers next, recognizing the quiet, loving work they do each day. We know many of you across the country are caring for someone, a child, a parent, a loved one, or you work as a caregiver. On this National Caregivers Day, in the midst of a pandemic, it's even more important to recognize the risk, the sacrifice, and the love you put into keeping the vulnerable safe. Ross Lord has the story of how one caregiver is coping during these uncertain times.
It's a challenging time for Carol Ann Alloway. She's the caregiver for her husband, Bill.
You know, it just adds to the isolation. Being a caregiver, you're isolated already because people don't really understand the physical and emotional stress that you're under. But this adds another layer to it.
She's among millions of Canadians caring for loved ones with long-term health problems or disabilities in their homes. Often, caregivers do exhausting work that puts them at greater risk of medical problems. And new research in Ontario shows only half of family caregivers have a contingency plan for COVID-19.
One of the strategies that we recommend is expanding your circle of care, looking at who could step in and provide support if you needed to self-isolate and not provide the care that you would normally provide as a caregiver.
They're developing an online portal where people can look for or offer help with things like groceries and prescription pickup. Carol Ann says she's less exhausted physically since Bill recovered from a series of ankle surgeries that left him immobile. Their biggest priority, she says, is the health of their children and grandchildren. As for their own health, they have a plan for one or the other to self-isolate in their home if needed. But that only goes so far when both have vulnerable immune systems.
It's a concern for both of us. If either of us gets it, and especially if we pass it to the other person, like, what happens if we both get it? Like, I can't even imagine.
Waiting out the pandemic with care. Ross Lord, Global News.
And that is Global National for this Tuesday. I'm Dawna Friesen. With Easter just around the corner, we thought you might be wondering about the status of the Easter Bunny. Well, not to worry.
Is the Easter Bunny coming?
Oh, we're making the Easter Bunny an essential service.
Ontario's Premier is one of many political leaders who have declared the Easter Bunny's work an essential service, and we're all happy about that. Thanks for watching. Take care of yourselves. Bye-bye.